Hi friends, I am Dr. Datta Ram. I am a surgical gastroenterologist. Today I am going to talk about acute appendicitis. Acute appendicitis is infection of the appendix. Appendix is a small tubular structure inside the abdomen. It is hanging from the large intestine, a part of the large intestine called the cecum. It is around 5 to 10 centimeters in length. Appendix is a hollow organ. So infection of the appendix is called as acute appendicitis. When a worm or a food particle or fecal matter gets stuck inside the lumen of the appendix, it leads to infection of the appendix, and this is called as acute appendicitis. What are the complications of acute appendicitis? The most dreadful complication of acute appendicitis is rupture of the appendix or breaking of the appendix. So whenever there is infection, the appendix gets swollen and becomes red, and when the pressure inside the appendix increases, it bursts open. It also leads to a gangrene of the appendix, and the appendix wall becomes weak and it ruptures. When the appendix ruptures, all the infection spreads all over the abdomen, and this can lead to serious problems like sepsis and multi-organ failure, and the patient will become extremely sick. So this is the most serious complication of acute appendicitis. When the infection is confined to one place, it may form a abscess or pus formation, or it may form a mass. So what are the symptoms of acute appendicitis? Pain is the predominant. Most of the patients present with pain abdomen. The pain usually starts in and around the umbilical region, and later with time it migrates or it gets localized to the right lower abdomen. This is the most common symptom of acute appendicitis. Most of these patients are febrile, that is they have fever, also nausea and vomiting. Pain is severe sometimes, and when they move, the pain aggravates, the pain increases, and sometimes many of these patients also may have 1 or 2 episodes of loose stools or frequency of micturition or increased urination. How do we diagnose appendicitis? So what are the tests for diagnosing acute appendicitis? Ultrasound is the first and foremost test what we order when we have a patient with acute appendicitis. The appendix is often seen as a tubular structure which is swollen and it doesn't compress on pressing. And when the sonologist presses, there will be tenderness. There is a lot of pain in that region. That's called as probe tenderness. Many a time, the diagnosis may not be very clear. In such cases, we ask for a CT scan. A CT is very objective test for diagnosing acute appendicitis, and it is almost very accurate for diagnosing acute appendicitis. What is the treatment of acute appendicitis? So first and foremost is IV antibiotics. Is the first thing we start. We hydrate the patient and start giving IV antibiotics. The definitive treatment or the best treatment for acute appendicitis is surgical removal of the appendix. That's called as appendectomy. Nowadays, we are doing laparoscopic surgery. So most of the patients who have acute appendicitis undergo a laparoscopic surgery. This keyhole surgery, removal of the appendix by laparoscopic method. After laparoscopic appendicectomy, most of the patients have a very steady and fast recovery. Pain is very minimal, and most of the patients will be discharged the very next day after operation, and they can resume their physical activities once the pain comes down. Thank you so much.